what do you estimate a patient's chances for experiencing a medical error of any severity classification?
Well, the medical studies that were available that became the first real medical study was published by the Institutes of Medicine in 1999. It was called To Err, to ERR, to err is human.
Yes.
And it projected 98,000 patient deaths annually, with an incident rate of anywhere from 2.7 to 3.8% of all patients experiencing some degree of a patient error. Degrees being, well, 5 different levels of error severity, with the last being death and the first being something that's inconsequential and doesn't require any treatment.
Yes.
The Institutes of Medicine study was really a conglomeration of several studies, of 5 different studies that included Harvard University, University of Colorado, and several other medical studies pertaining to medical errors, where they extracted their error data or statistics was from patient discharge records within hospitals.
Okay.
Now, a later study in 2006 titled appropriately Death from Medicine, it was discovered that only between 5 and 20% of medical errors are ever reported within a patient discharge records. Now, if this is something that was unknown in 1999 during the Institute of Medicine study.
Yes.
So consequently, the figures of 98,000 in reality become 900 and some thousand.
Yes.
And the incident rates of errors being, 2.7 as projected in the IOM study, 2.7 to 3.8%, now become between 25 and 33%.
Wow.
So 1 out of every 3 patients going into a hospital either on an emergency basis or through elective procedures have a chance of incurring a preventable medical error.
Wow, Bill, that's a startling statistic, and I just want to point out for those of you watching that we're talking about just hospital errors. If you want more information about this book and this subject, remember medicalerrorpandemic.com. All the information, availability for book for purchase, and other information as it becomes available will be on that website.